That was amazing, Imroze. I learned so much. And your slides are so beautiful. I love the way you've like used the illustration. So really well done. Um, a lot of it resonated for me because I've done work in healthcare before, and some research with Muslim communities. And so the way the things you talked about with translation are very common. So it was really cool to see how what you've identified in Canada with the Punjabi community is also very similar in the UK because it's both a Eurocentric system with diaspora. So yeah, that was really helpful. And I think that so many people can learn about like be in a different context and still learn so much from it. So yeah, really well done. There's so many things I could say, but it's not about my thoughts. It's about the questions and your answers. So yeah, it's really excellent work, clearly very thoughtful and crafted. Have you been able to implement this framework at all in the Canadian healthcare and social systems at all? And if not, what are the barriers? But if so, what has the feedback been from community groups, families, and providers?
Yeah, currently as a consultant where I work very closely with University of British Columbia's research department, which is digital emergency, and in there is a project called Icon Project. I've been able to implement a lot of these uh, things from the framework that I've just talked about. I think the translation one was very easier to implement because there is not that big of a restructuring that's involved with it. But where the barrier has come in is with um, trying to actually restructure the narrative about how to disseminate knowledge. So, for example, trying to get the ministry, British Columbia Ministry of Health in Canada, trying them to get them to understand how the community understands information rather than just translating content which has been designed from a very Eurocentric perspective to Punjabi has been complicated because it's easier if you just design the content itself that's factoring in the Punjabi community and the marginalized community at this point. That's been very hard because according to them, they are saying that oh, you have to work with this department because you have to reflect on mental health. So it's a lot of bureaucracy that goes into the departments to departments. And at that point, when policy gets involved, bureaucracy gets involved. And something that can be fixed in 2 minutes ends up taking 2 years at that point. So that's the main barrier at this point.
Yeah, I can definitely see how that's tricky, especially because things become so fragmented in these big systems where, and you're looking at something that is so holistic and is seeing how complex it is for the person, but the system doesn't necessarily see it that way. So I
Mhm.
can definitely see why that's a challenge. Um, you also mentioned that some elements of this framework could be adapted for other minoritized communities in Canada. Do you have any expectations regarding to what which specifically could benefit from such work?
Yeah, so recently we were able to translate a lot of this framework um, points into a lot of the Chinese community that we're also working with. So it's been able to work alongside with that. The good thing is that the adoption of digital health literacy, for example, especially with the use of platforms like Zoom, for example, disseminating knowledge has been very effortless for the Chinese community, whereas for the Punjabi community has been a little bit slow. But that doesn't mean that there is no adoption. There is more adoption of social media content. It's about understanding where the audience is consuming the content and catering it according to that as well. Um, we recently noticed where um, it's coming up across with this framework is finding more relevancy among the diaspora that's more newer to a country. So, for example, the Filipino diaspora in Canada, it's been working very closely, and Vietnamese too, because it's the reliance of the older generation on the younger generation. So how to actually foster and empathize community with the younger audience has been easy to translate. But then again, um, the UBC, so certain departments will understand that, but on a bigger level, for it to understand, there needs to be policy change at this point, because the community engagement versus being an individual is two different things.
Right, that makes sense. That makes sense. We have a comment. I would just read it out loud. Just I haven't read it yet, but we have a comment. So this work is brilliant. You mentioned the way this could be adopted and adapted to other immigrant communities. I think it could also be useful to other linguistic minority communities. Reminds me of a friend. Sorry, it's getting late here, so me reading out loud isn't going as well as it was. Reminds
So,
me of a work a friend of mine did accessing the NHS as a deaf person. She found similar insights of children or family members being used as translators and sometimes having to convey devastating news, which is also untrauma informed and harmful. Yeah, definitely. I heard about that when I was doing research too. Do you have anything to talk about with that, Imroze?
100%. I think, first of all, disability justice and accessibility is also very much explored from a very Western angle as well. So it has not been explored from more of like a cultural angle, as in from an immigration angle as well. There is no certain words that exist in a lot of languages, especially in Punjabi, there where you can even refer to a person who has visual impairment without actually, I'm running out of words as well too, but without actually offending them, or even there is no polite way of addressing a certain person's impairment and everything too. So there's that, and but at the same time, for example, imagine you're a new immigrant and you do not speak English, and you learn sign language in a totally different language as well. And there is no translator available for that. So good luck explaining your diagnosis at that point. So there is a lot of different things that are unexplored at this point. And yeah, it's anytime when there is a linguistic barrier, there's a lot of experiences that get overlapped, which is another study waiting to happen.
Yeah, definitely. I also just got reminded of a friend of mine who's a doctor and speaks really good Farsi conversationally, but isn't comfortable speaking to patients in Farsi and will pretend that she doesn't know any because she doesn't know the medical language. So I think that's also something to consider is like how we need to help people learn the language that they may speak, but better for medical if they want to do that as well. So
Yeah.
language is complex.
Mhm. Yeah. Yeah, like one of the examples is that, for example, there is no direct translation of the word depression in Punjabi. The word that gets used directly for depression also gets used for being sad or being blue. So there is a lot of context that need to be added when you're translating. So, for example, if you take depression and put it in Google Translate, and you don't have like context attached to it, then that's a whole can of worms. Yeah.
Mhm. Yeah, that's really helpful. Thank you. We have one question in the chat. So, amazing talk, Imroze. There's such a commonality with the UK, which it's proven to be institutionally racist. What suggestions do you have to influence senior management in organizations to think differently in design, who often come from backgrounds of privilege, entrenched in perspectives which inform policy, which is found to be harmful?
Um, that's a it's a great question. Thank you so much for that. I think um, that's 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 a that's a hurdle that I've faced before. That's the reason I decided to take on this research, and this is the hurdle that I'm facing currently right now as well. So this is an ongoing effort. I think first thing that has been very much in a place that I have the privilege to be that voice in a room full of people that don't understand this concern as of right now. And second is calling performance as performance when it's happening, rather than rather than clapping or appreciating it, because when performance happens, we disappear, we leave, and nothing has happened at that point. So there's a lot of performance that's happening as of right now with no praxis. Um, second of all is in order for change to happen, the power dynamic needs to change, and people in charge of power need to understand that they are holding power as well. And in order for change to happen, there needs to be a certain give and take that needs to happen. So people in charge, people in power need to give certain power as well. And at the same time, they need to understand that if they're serving certain part of the community, is that community being represented in the management, not just the assistants at the lower level, is the management reflecting that as well. So that's a something that I would recommend. Yeah.
Great, thank you. Yeah, that resonates a lot. So yeah, I think that's all we have time for today, but thank you so much for your time and for providing your talk. We're really thankful to have you. I'll put the I'll put the feedback form on Slack so people can provide feedback. And then this is the end of the talks, and then we'll have a coffee chat starting, I think it's in half an hour. Yeah, in half an hour, if people want to join that. And then tomorrow we'll come back for the theme approaching sensitive topics, and we'll have 3 brilliant speakers who will be sharing practical and considered approaches to consider and mitigate harm towards those we engage and involve in design and research. So yes, thank you everyone for bearing with me through today. And yeah, we're really excited to have seen these talks. So thank you for joining. Great.
Thank you so
Okay.
much. Thank you,
Bye,
Claudia.
Imroze.
Thank you, everyone.